Episode 27, Series 2 of 1001 Stories of Health. The Body Whispers. Tom, a clinical educator, worked in a busy hospital where he taught patients and junior staff about health management, hydration, stress control, sleep, medication adherence, and early warning signs of illness. After a long shift, he stood in the staff room watching the sunrise, still mentally tied to the hospital rooms he had just left. The clinic air, ventilated spirits and cheap floral air freshener usually sharpened his focus, but today it only deepened the headache behind his eyes. Despite his expertise, Tom found himself experiencing the very issues he warned patients about. He was dehydrated, exhausted, and running on poor nutrition after a night of continuous patient care. The realization unsettled him. His professional knowledge had not translated into personal discipline. When Abdul, another clinician, joined him, both men recognized the shared fatigue of a system that demanded constant output while quietly eroding the health of those who sustained it. The contradiction became clearer. Healthcare workers were functioning as educators of well-being while neglecting their own. A conversation with Abdul triggered reflection on the deeper pattern. Tom began to see that burnout was not an individual failure, but a structural habit within clinical culture, where rest was delayed, meals were skipped, and recovery was treated as optional. He recognized that the problem was not just patient behavior, but also the environment shaping caregivers themselves. Tom proposed a shift in practice. Structured hydration breaks protected decompression time after critical cases, and uninterrupted meal breaks except during emergencies. He framed it clearly as a patient safety measure, not personal comfort, because delayed decisions from exhausted clinicians lead to complications. Before leaving, he committed to immediate self-correction, finishing his water, eating, and taking a few minutes to reset mentally before going home. The lesson became clear. The same principles taught to patients, rest, recovery, and listening to the body, had to apply equally to those who delivered care. The real intervention was not only for patients, but for the staff who cared for everyone else while neglecting themselves. Want more stories? Receive valuable health insights twice a week from 1001 Stories of Health at 1001storiesofhealth.wordpress.com or click the link below.